Good day, my dear undergraduate students. Welcome to R.A.T.S and Pathology. Shortcut to success, 4 spotters for this day, 1 minute each. I would like you people to just observe this picture. There is an organ and another structure adjoining it, which is very important and you should be able to identify it in the specimen. Now, this is the specimen that shall be given to us. It is a mounted specimen of the testis. I am able to identify it by means of the epididymis. The size and the weight are reduced. You must be measuring them. The external surface is gray-white, smooth, and covered with tunica. These are keywords. Please memorize. And a normal testis is given for control. The diagnosis is atrophy testis, gross. This is another specimen again given for comparison. Here there is an atrophic testis, there is a normal testis. It will be having a thready kind of an appearance. The epididymis is stretched over it. Here it is almost, the testis is almost shrunken, homogeneous, gray-white, pale. No areas of hemorrhage or necrosis. The scale is given for comparison. It can happen in a case of cryptorchidism, senile atrophy, or due to any hormonal cause. These are for recollection, not for writing. And this is again a slide. It is a germinal epithelium. It will not be kept for the exam, but in this, I am not finding the germinal cells, but I'm finding only the Sartori cells, a classical example of atrophy testis. These are the sources. The next slide is, I hope you people are able to identify the structure. You are supposed to identify the ventricles, interventricular septum, aorta, pulmonary artery, and SVC. You may not get all this, but this will definitely be our specimen. So it is a part specimen of the heart, which is mounted. The left ventricle, this is the left ventricle. The wall is thickened, anterior, posterior, lateral, as well as the interventricular septum are all uniformly thickened, and the lumen is correspondingly reduced. The right ventricle is unremarkable. The key points, please memorize. It is a case of hypertrophy of the left ventricle. Again, a schematic picture that can be drawn in the record. I am able to see the hypertrophied heart in both the pictures over here. There are two types of it. In one, it is uniformly hypertrophied, called as a concentric hypertrophy. In another, on one side, it is called an eccentric hypertrophy. The causes can be valvular stenosis, incompetence, hypertension, or any hyperdynamic circulation. This slide will not be kept, it is kept for comparison only. The normal myocardium and look at the thickened myocardial fibers. References are here. Cardiac hypertrophy, left ventricle. Spotters are the key to success. This is again a specimen that is being resected, in which I am able to see the small intestine. Small intestine will not be having the tags of fat or appendices epiploicae along with it. So it is almost bland. But the color is, there is a blackish or a brownish discoloration that can be made out. The normal loop of the intestine is shown here for comparison. And this is the mesentery that is holding the loops together. This has been resected out because it is not normal. So it is a case of mesenteric ischemia and a volvulus. What is a volvulus? We shall be seeing. Or it can happen in adhesions, intersusception, or strangulation. There is a blackish discoloration and it is edematous, it is swollen, shiny. This is a normal intestine that is given for comparison. The mucosa is viable, whereas here it is gangrenous. So this can be an intersusception. A loop goes within a loop, as in this surgical specimen. or in this. It is called as intersuscipiens interseptum. One part goes within another. This is an emergency where it is operated. The next specimen is, I hope you people are able to appreciate the tangled mass of parasites. It is ascaris diagnosed by means of the pointed edges and the round contour. Sometimes there are too many that they cause an obstruction, and this can lead to a surgical emergency. Thanks to Dr. Vikas Arora for this picture and eye stone. And here again, it is a surgical emergency. It is almost obstructing, as a result of which there can be a volvulus, there can be an intersusception, or there can be an ischemia. So it is a segment of intestine measuring so many centimeters long, blackish gray discoloration, lumen filled with tangled mass, and the parasites are pinkish gray in color with tapering ends. Roughly, you can mention the measurements. It is a case of gangrene intestine with ascaris lumbricoides. Because of volvulus, it has come as a surgical emergency. So once again, a picture being removed, and this is what we see microscopically. This is normal. These are all gangrenous portions that is seen. This slide will not be kept. It is for comparison. These are the various causes, and you will have to separate the gangrenous and the viable areas. Kusantak. See you in class.